Mesothelioma is a rare form of cancer that is typically related to asbestos exposure. There are three types of mesothelioma: pleural or lung, peritoneal or abdomen, and pericardial or heart. Pleural mesothelioma is the most common form of mesothelioma, accounting for 60 to 70% of all cases. Peritoneal and pericardial mesotheliomas are much less prevalent, representing only 30 to 35% and 5% respectively. Mesothelioma is often difficult to diagnose because there is a latency period of 20 to 40 or more years before the onset of symptoms. Only 2,000 to 3,000 new cases are diagnosed each year, with most patients being men between 50 and 70 years old. Complicating matters, the disease's symptoms are usually similar to those of other common sicknesses, and patients are sometimes mistakenly treated for other ailments. A majority of patients with mesothelioma worked closely with asbestos in mining, manufacturing, or construction industries. A number of men who served in the United States Navy and worked with it in its shipyards have also developed the disease because asbestos was used exclusively in the construction of ships. There are also instances of family members of these workers developing the disease due to secondhand exposure in which asbestos fibers were attached to the workers' work clothes. Mesothelioma is a unique cancer because it does not have one solid detectable mass. Instead, the tumor sprawls along the lining or the mesothelium of the lungs, heart, and abdomen. A common symptom of mesothelioma is pleural effusion, or fluid buildup in the pleural area between the lungs and the chest wall. Oftentimes, this is detected by CAT scans or chest x-rays. Mesothelioma is often confirmed following a number of procedures including a biopsy, tissue test, MRI, and PET scan. Mesothelioma is usually regarded as localized if the cancer is found only where it began. It is considered advanced if it has spread to other portions of the body. Once diagnosed, doctors will determine how advanced it is, how much it has metastasized or spread, and if there's any lymph node involvement. This process is called staging. Mesothelioma, however, does not follow the standard cancer staging system because the cancer is unpredictable in the way that it grows. There are several staging systems currently being used for mesothelioma. The staging systems include the TNM staging system, the Bouchard staging system, and the Brigham staging system. The TNM staging system is the major staging system. T equals tumor and refers to the tumor size and how far it has spread to nearby organs. N equals spread to lymph nodes. And M equals metastasis, whether the mesothelioma has spread to any other or distant organs. The TNM staging system assigns categories and numbers to determine the overall mesothelioma stage. Of course, mesothelioma patients with lower stage numbers have a better likelihood of recovery from the disease or a better chance at long-term survival. The Bouchard system, the oldest of all the staging systems, is based on the magnitude of the primary tumor mass. It divides mesothelioma into the 4 stages, and it is still currently being used by many specialists in the field. The Brigham staging system also uses 4 stages, and it is based on whether the mesothelioma can be treated or removed by surgery. It is also based on whether or not the body's lymph nodes are involved. There are 4 mesothelioma stages: Stage 1, Stage 2, Stage 3, and Stage 4. Staging is the process of finding out how far the mesothelioma has spread. It is based on imaging studies such as X-rays, CT scans, and MRI scans. The type of treatment and the prognosis for the patient depends on the stage of their cancer. Once the stage, type of mesothelioma, and overall health of the patient have been determined, the doctor will explore the various treatment methods. Stage 1. Regardless of the staging system used, it is necessary that the cancer be localized in order to have an effective, aggressive treatment plan. Many stage 1 mesothelioma patients often undergo various types of surgery to have the tumors removed. There has been some success with a combination of chemotherapy and radiation treatment also. Stage 2 and 3. Unfortunately, mesothelioma is often diagnosed when it's already very advanced. When the cancer has progressed into stages 2 and 3, it is treated the same. Treatment options include palliative and supportive care, providing relief of symptoms, such as removing fluid accumulation in the chest cavity and abdomen. In some cases, surgery may be possible. Finally, the doctor may choose radiation therapy or chemotherapy aimed at easing symptoms. Cure is usually not possible for patients in these stages. Stage 4. Once mesothelioma reaches stage 4, there is no cure. Depending on the treatment plan, it is possible that mesothelioma may return in its original location. It is more common, however, that the cancer will turn up in another portion of the body. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.